Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola from Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. Well, in this next installment of our series on Fast Facts on pain management, we're going to talk about more of the physiology involved in pain and pain management. Now, we all know that, again, when you damage tissue, you release substances that are called algogenic substances that cause pain and inflammation. Okay, well, those substances vary, but the one we like to focus our attention on are prostaglandins. Well, where do we get these prostaglandins? What are they? Where do they come from? And how do we get rid of them? Okay, well, prostaglandins come in two flavors. They do? Yeah. Pathologic prostaglandins and physiologic prostaglandins. Well, those are names I've heard thrown around for some time now. What's the difference? Well, the pathologic prostaglandins, I'm sure as you might imagine from the name, cause things like pathology. Well, pain and inflammation necessarily. So those pathologic prostaglandins, those are the prostaglandins that we identify as being released from damaged tissue that send the nociceptors into a tizzy and send the message to the brain saying, hey, there's been tissue damage down here. Okay, so we know that they're responsible for causing pain and inflammation. But remember, there's another side to prostaglandins, and those are the physiologic prostaglandins. Those are the prostaglandins that, even though they bear the same name, don't do necessarily bad things, but actually good things for you. Like what, Viola? Well, for example, physiologic prostaglandins would be responsible for things like generating mucosal lining in your stomach that prevents your stomach acid from digesting you from the inside out, right? So that thin layer of mucus that buffers the acid and keeps it from digesting the stomach wall, well, that's contributed to you by your friendly neighborhood prostaglandin. It's also why ulcerations of that mucosal lining can be so deadly, right? But in addition to that, renal protection. Your kidneys need to be constantly perfused with blood. One of the ways that happens is because prostaglandins keep that blood flow steady and reliable. Okay, what else? Bronchodilation. I mean, it's difficult to keep your alveoli and bronchioles dilated when you breathe out because it's negative air pressure. But through a combination of surfactant and prostaglandins, which relax the bronchial smooth muscle, we can accomplish that as well. So these prostaglandins are helpful for you breathing. Yes. And finally, what about bleeding? Okay, bleeding is definitely dangerous for our health, okay? But you've evolved a series of systems in place to seal your pipes, if you will, from the inside out if there's ever a leak sprung, okay? Bleeding. What do you mean I can seal the pipes? Well, you have a clotting mechanism. Well, where'd you get that clotting mechanism from? Well, one of several avenues that leads to clotting is indeed prostaglandins. So keep in mind that while we use the word prostaglandins a lot in pain management to talk about the prostaglandins that cause pain and inflammation, there's that other side of prostaglandins that are good for you. So what we really want to do is get rid of the bad guys, but keep the good guys. Is there a way to do that? We'll find out next time on our next installment of Pharmacology Fast Facts, when we talk more about pain management and the road to resolving pain and keeping pain from being a demotivator for our patients. Until then, my friends, this is Tom Viola. Take care. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.